Now, the government may have stepped in to help reduce household bills this winter with its new energy price cap, but some charities believe more must still be done to support people with the cost of living. And one fears that a lack of support could lead to a mental health crisis. And joining me now is Helen Undy. She's Chief Executive of the Money and Mental Health Policy Institute. Helen, thank you so much for talking to us. That sounds particularly ominous. Why do you believe there's that correlation?
So we know that the link between financial difficulty and mental health problems is really strong. You are much more likely to be experiencing mental health problems if you're in financial difficulty. And looking at this year in particular, we came into the year with increased levels of depression and anxiety that rose during the pandemic. And even back in May, our research found that 1 in 5 UK adults already said that they were unable to cope as a result of the rising cost of living. And that's back in May, when bills were not as high as they are now, and most people were able to have their heating off. So we're concerned about what will happen as people are heading into this particularly difficult winter.
And you've called this a toxic cycle, the financial hardship that leads to poor mental health.
That's absolutely right. So financial difficulty can drive mental health problems. We know that half of people in problem
because
debt
you're just so worried about everything.
Yes, so we know that this is going to be a really difficult winter. Financial difficulty can drive mental health problems, whether that is through the anxiety and worry about being in financial difficulty, or through things like debt collection activity. So there's a real link between receiving debt collection letters and telephone calls, visits from bailiffs, and experiences of suicidality and suicidal feelings. Suicide is always complicated. It's never more than just one thing. But you are 3.5 times as likely to consider suicide if you're in financial difficulty. So we believe it's really important going into this winter that not only do people have enough money to live on, so that means the freeze in energy bills is really helpful. We also want to see benefits increased in line with inflation, which will be absolutely crucial for those on the lowest incomes. But also that the government's update to the suicide prevention strategy, which is due, but we've not heard any more on since the new government came in, that happens, and that update really reflects the impact of the cost of living crisis, so that both financial and mental health support reach those people who need it most.
At the moment, what sort of help or treatment can you get from the NHS or from the government if your mental health is suffering?
So if you're struggling with your mental health, your best first port of call is usually to go to your GP. And the most likely thing that will happen is your GP will probably signpost you through to talking therapies, or you might receive some medication and that kind of support, which is very useful. We have quite a well-developed mental health system, but unfortunately there are still long waiting times in large parts of the country. And we know that while people are waiting for mental health services, their finances are likely to be getting worse. So the earlier people can get access to treatment and support, the better. But we also have really poorly integrated money and mental health support. We would like to see everybody who is using mental health services to be routinely asked if they are experiencing financial difficulty, because that financial difficulty is a real drag on recovery. It's really hard to get better in terms of your mental health if after mental health appointments you are receiving letters on your doormat with debt collection demands or text messages from bailiffs while you're trying to talk to your therapist. So we would like to see everyone using mental health services routinely asked about their money and then signposted to money and debt help, which is available, and it's available for free within the charity sector. So we need more people to have that integrated support on both sides.
Just briefly, Helen, because I'm sure what you're saying will resonate with just so many people, particularly now. But if someone is feeling completely overwhelmed in both areas of their life, what would you suggest they do?
So there is no debt problem that is unsolvable, and there is free debt help available. So I would suggest, as a good first port of call, getting in touch with one of the national debt advice charities. So that could be Step Change, Citizens Advice, National Debtline. Get in touch with one of them and they will talk you through your situation. It won't cost you any money and they can help you find a way through. If you're struggling with your mental health, as I say, your GP is a good first port of call. If you need more urgent help and you feel like you are at risk of hurting yourself, the best thing to do is to call 999 or go to A&E, or you can always speak to the Samaritans, and they're available 24/7 as a listening ear. So yeah, I would really encourage people to seek help.
Okay. Helen, thank you so much. As Helen said there, no debt problem is unsolvable. Helen, thank you.
Thank you.
That chat I had with Helen, you can contact the Samaritans. Their helpline is 116123, or you can email joe@samaritans.org.